It's my great pleasure to introduce Commissioner Doyle. Brooke Doyle was appointed Commissioner for the Department of Mental Health in October of 2020. She's a licensed mental health counselor. She has both clinical and management experience and is a longtime champion for mental health parity and mental health access. Her experience in the fields of homelessness and substance abuse disorders is critical as we continue to reduce barriers to service access. Prior to being appointed as commissioner, she served as the deputy commissioner for mental health services, where she oversaw DMH's adult service delivery system. She led interagency planning and projects, and she provided administrative and clinical leadership and monitoring for all aspects of DMH statewide service compliance. Commissioner Doyle is an alumna, as am I, which is very exciting to see, of the University of Massachusetts, where she received both her master's in education and rehabilitation counseling and her bachelor's degree in psychology. With no further ado, we are very, very pleased to have Commissioner Doyle with us today to share her thoughts. Thank you.
Thank you for the warm welcome. I appreciate the opportunity to join you here today and to offer a few welcoming remarks. So without further ado, thank you for joining us for today's conference, the Department of Mental Health Centers for Excellence Research Conference. This annual conference provides a wonderful opportunity to hear about the compelling research that's happening here in Massachusetts to improve the lives of people experiencing mental illness. This is one of those unique gatherings where we talk about research from the perspective of people whose lives are affected by mental illness and from the perspective of the people who love them. The people at this conference often talk about challenges providers face in navigating new systems and technology while maintaining a personal connection with the person who's receiving the services. The pandemic only made our mastery of these advances even more critical. The integration of medical services and behavioral health services have become increasingly more important since the conference was last held in 2018. The state's new behavioral health roadmap intends to provide a more integrated and accessible path to mental health services. In 2018, DMH opted to revise the procurement for its research centers of excellence to create a focus on the science of implementing evidence-based practices. And this led to a new Center of Excellence for Public Mental Health Services and Implementation Research. DMH also wanted the work of its two centers to be responsive and collaborative, as well as coordinated with the communities served. We wanted the centers to be race, equity, and inclusive focused, and to work with the Massachusetts communities that have been traditionally not engaged in research, and to elevate staff that reflect the diversity of our state. Today, we are pleased to hear from our two centers in the first conference since their creation. The Center for Excellence for Systemic and Psychosocial Research at MGH, with Dr. Corey Cather as the center director. The mission of this center is to advance treatment and rehabilitation and recovery of adults and children and adolescents with serious illness or severe emotional disturbance through psychosocial, forensic, and program services research. The Center of Excellence for Public Mental Health Services and Implementation Research, with Dr. Marianne Davis as the center director, the mission of this center is to conduct, disseminate, and support the use of research in public mental health systems to improve the lives of those with serious illness and support rapid implementation of research findings in real-world settings. We are excited to hear about the work of these centers today. Our thanks to our research centers of excellence and their consumer advisory councils for bringing us together today and for fostering these important discussions. I hope you all enjoyed today's presentations, and thank you for joining us.